We're going to talk to you about a number of things, but I just want people to know right off the bat, you are both recovering from COVID-19. Duncan, how are you both doing and feeling?
Feeling certainly better. I was down and out for about close to 2 weeks, but over the past couple of days, fever's gone down, aches and pains have basically gone away. I'm hoping to get the all clear from public health sometime in the next few days.
Excellent.
And Pam is...
Pam, I know Duncan's going to be the main storyteller with us this morning, but I do want to know how you are feeling too personally.
Well, I'm feeling fine. Throughout this, right from the beginning, I have felt fine. When I was tested, I had a low-grade fever, which I didn't know I had. And a few days, I had a bit of a runny nose, but felt like I was getting a cold, and it never developed. And that's been it for me.
Isn't that interesting?
I've been feeling fine other than that, and I've been doing what I normally do.
But at home.
I've been out walking on our property. We have a large property, so I was able to get outside and I'm
do
feeling
that.
great.
Well, we'll talk about that, how you're handling this, because that's really the message of our conversation this morning, I know, Duncan. You were traveling in Texas, and that's where it seems to be associated with travel that you both contracted COVID-19. And when Texas was starting to look a little bit dicey, I know you came home and cut that trip short. Just tell us a little bit about how you were taking precautionary steps from the very beginning here and how you handled your return.
Well, we had the normal things. We had hand sanitizer. We had alcoholic wipes. Every plane ride we took, and there were 3 of them coming home from San Antonio to Halifax, we wiped down every horizontal surface, trays, seat backs, armrests, anything that we thought we could touch in both the airplanes and the airports. We really felt we had covered our bases in terms of protecting ourselves on the way home.
And then you had friends, I know, do what everyone advises, have already made all the arrangements for you for groceries and things. So you were able to go right home from the airport when you did eventually get home to Nova Scotia. And then how have you approached the whole idea of self-isolation, Duncan?
Well, first of all, right from the get-go, we had never planned to go anywhere other than directly home. And we... the moment that we left the Halifax airport, we never came in physical contact with one single person. And in fact, that's still the case today. Had we not done that, because we felt perfectly fine coming off the airplane, the symptoms didn't show up for about 3 or 4 days. Had we not come directly home, those 3 or 4 days, I'm sure we would have infected a number of people who would have, in the cascading effect of this virus, infected a bunch more people. So at the very least, we got this virus, both of us, but at least by doing what we did, we kept it to the 2 of us.
Which is exactly what health officials are urging right now. Pam, you mentioned you're able to walk the property and how fortunate you have that outdoor outlet there in your place in Lunenburg. But what would your advice be to people? You know, some people are reluctant, it's monotonous, it's boring, what have you. I mean, what would how you have handled it and approached it, what people could learn from that in their own attempts to stay in?
Well, I just keep on thinking that if I do go outside or if I meet up with someone, then I could be passing the germ on to them, especially since I had no symptoms. I'm considered a dangerous one because I felt fine, and if it hadn't been for Duncan, I wouldn't have been tested. So I've just managed to go about, of course everyone says, oh, I'll get the house all spring cleaned and everything. Well, I haven't done that. I do little bits like I always do. I get outside as much as I can, and I have a couple of hobbies. I read and I knit. So I've managed to keep myself busy, and we have been overwhelmed with the support we've received from our family and friends. So I spend a lot of my day talking on the phone, so that helps too.
Connecting in that way. Duncan, I mentioned introducing you that we're hearing more and more from government officials that they are really toughening things up. They have bylaws in place now. They are enforcing this. There are fines for people who are breaking self-isolation, who are being in places that they shouldn't be in large groups. I'm wondering what you think of those measures, and also what your message would be to Canadians in terms of following the rules as they're set out now.
Well, I mean, I am supportive of trying to curb those that seem to want to ignore the obvious answer to keeping this thing from spreading. Quite frankly, we went public for that exact reason. At that time, I think I was number 29 in Nova Scotia. So the chances of a Nova Scotian knowing someone who had this COVID-19 was probably pretty slim. So I thought, perhaps there's folks out there that really associate this virus with Italy or Iran, China, or some other spot that really they didn't connect with. So perhaps if we put a face and a name, a local face and a local name to this virus, that they would take it more personally and do what the government is currently asking them to do. So that's why we went public, quite frankly, to begin with. So I'm obviously very supportive of the government's ask in this, and I guess it's the plea of the public to heed their warnings.